Hi, I'm Dr. Timothy Shin, and once again, welcome to our Heart to Heart video series in celebration of American Heart Month. Today's video features Dr. Jordan Knepper. Dr. Knepper is a vascular surgeon, and Dr. Knepper treats conditions that impair blood flow throughout the veins and arteries. He performs both surgical and non-surgical procedures to treat anything from varicose veins to aneurysms of the main arteries in the abdomen. On February 24th, during our question and answer series, we will answer any questions we receive during our Heart to Heart video series. So please leave your questions and comments for Dr. Knepper in the comments section.
Thank you, Dr. Shin, for that amazing introduction. Hi, I am Teresa from Marketing and Communications. And as Dr. Shin stated, today I have with me Dr. Jordan Knepper. Welcome, Dr. Knepper. Can you tell us a little bit about yourself?
Yeah, hello, and thanks for having me today for our Heart Month series. My name is Jordan Knepper. I'm a vascular surgeon, which means I specialize in surgery of all the blood vessels in the body that aren't on the heart and aren't inside the head. And that can be from carotid artery surgery to prevent stroke, to varicose veins, to aneurysm surgery in different part of the body. I've been with the organization for about 5 years, and I'm really happy to talk to you all today.
That's great, thank you. So can you tell us the difference between venous disease and heart disease?
Yeah, so the heart is the pump, and the veins and the arteries are the plumbing. So if we were to look at the plumbing, when it fails, the vein system is the drainage system to get everything back to the heart pump. So it's part of the system, but different parts of the plumbing that need to be repaired.
I like how you use that analogy because people can understand that when you're talking about it. It's hard when you start explaining different veins here and there, but by doing the plumbing, that's a really great way to relate to us.
And just like the plumbing, the arteries are the high pressure side, just like in our sink where the water's coming in, and the veins are the low pressure side, just like our drains, and that gets all moved around by the heart, which is just like the pump. So it really is just a big plumbing circuit.
That's great. So can you tell us, what types of venous diseases do you see?
So there are really a few kinds of venous disease, and some people are born with some certain kinds of vein disease. Some people acquire their vein disease over time, either from blood clots or the check flow valves in veins getting broken or worn out over time. And some people might get a mixture of those. So some are acquired, some are inherited, some are what we call reflux, backward flow, some are blockages. And it's just like a plumbing system like we talked about how we fix them and what kinds of problems they cause.
So I know that there's different types of procedures that you can do to help with these blockages. Can you explain a few of those?
Sure. The most common procedure we perform on veins is what we would call an ablation. And a very common vein to act up in people is a vein in the leg called the great saphenous vein. It runs down the middle part of the leg, and it allows skin drainage. And over time, with pregnancies, injuries, or just inheriting valve tissue that doesn't last, that vein can start draining backwards instead of back towards the heart, and that causes pooling, ulcers, which are sores, varicose veins, and many other problems. And the most common solution for that is to put a tiny catheter inside that vein and heat seal it closed so that it can't act up anymore. And that's probably the most common procedure we perform on veins.
It's amazing the technology that we have today that we can do something that simple, then it changes somebody's life.
Absolutely.
So can you tell us some of the warning signs that there might be for somebody to see a vascular surgeon?
Sure. So particularly for veins, when we start having bulging veins in our legs that are uncomfortable, that's a medical disease. That's not a cosmetic problem. Varicose veins affect our lifestyle, affect our function, and if left untreated can lead to sores and wounds that don't heal. Blood clots can occur and many other things. So if there's concern, if there's pain and it doesn't seem right, reach out, because I think removing the stigma of it being a cosmetic disease just for looks is really one of our big missions, and making sure we know that vein disease is a medical illness and there's not only a treatment for it, but that treating it helps your life and prevents significant comorbidities and problems down the road.
So speaking of that, seeing somebody, we do here at Henry Ford Allegiance Health, we have those free vascular screenings. So what type of people would go to those screenings? And can you tell us a little bit about the screening?
Yeah, so as part of our clinic infrastructure and hospital infrastructure, we have a high-level accredited vascular ultrasound lab. And that they do studies from vein studies to carotids and all sorts of things. And if you have truly high-grade medical venous disease that your doctor sees, they can order that study and get a dedicated vein study. If we're having some varicose veins that you're not sure is an issue, or that you're just interested in seeing if you have some tendencies for vein disease, those would be the people who a screening would be for. And that's a free service we offer. If you call our vascular lab at 517-205-1301, you can reach out to our staff and they can tell you what times those are available. And people really enjoy those, and I think that they're very informative to people. They're free, and there's screenings for many different types of disease, and the folks in our vascular laboratory can really help with that.
So how often should they have a screening?
So if your screen is normal, you probably don't need another one. There are some surveillance tests, and really those would be up to the guidance of you and your doctor if disease is truly present. But if things are normal, I would say no more than every 3 years should we really recheck, because if we're not having something significant enough for you to speak to your doctor and we're just interested, that's the time period where things are unlikely to change.
Okay. So I know you've worked in hybrid OR and some different things like that, but can you tell us some of the really great newest technologies around venous disease and the surgeries and things? So
the most important advancements in vein disease treatment is becoming more and more minimally invasive. And we're sitting in our Heart and Vascular Institute lobby here, and actually just about 10 steps away, we have a beautiful procedure center where we perform the bulk of our venous treatment. And we do those in an outpatient setting. The ablations that we talked about, there are chemical injections that we can do. There's even glue to seal these up, and really we can tailor that to your needs and how complex your vein disease is. And you mentioned the hybrid operating room. Some people may have significant enough vein disease that we need to go to that operating room with x-ray capability to put stents and improve drainage. So we would like to say that we really have a comprehensive venous treatment program, so we can treat from the least invasive to the most invasive and really tailor it to what's going on.
And there's so many changes that are always happening, and I know that our vascular program, everybody's studying and constantly researching on how to do things and make things better and easier for the patient. And I like how you were talking about outpatient, that we've switched to outpatient more because we've learned all these great techniques. So can you speak to the difference that might be where somebody would have outpatient versus having to stay in the hospital?
Yeah, so I think many people that may have heard of their parents or grandparents having vein strippings, which was the surgical removal of veins. And 20 years ago, that's really all we could do. Now we can close veins by chemical, heat, and other methods. And probably 95% of people can have that treated in the outpatient setting. Some of those vein diseases that we're born with, where we have significant blockages or major blood clots, would require treatment in the hospital setting, but those are much more rare and things that we really have to sort out.
So you also talked about the aortic valve and type of thing. So can you do minimally invasive procedures on that, or is that a hospital stay? Great
question. So our aortic aneurysm program is very comprehensive and very high volume. And 80 to 90% of our aortic procedures, whether they be thoracic aneurysms, abdominal aneurysms, or blockage-based procedures, can be done minimally invasively. We do almost all of those in that hybrid operating room for imaging. Many of those require an overnight hospital stay for observation, but compared to the 7 to 10 days in the hospital of the previous procedures, they're still very minimally invasive and are in kind of an observation or minimal hospital stay setting.
That's great. That's amazing, because that's what Legion's is all about, is taking care of our patients, making sure they're at home to recuperate, because we know that's better for them and what have you. So I really appreciate you being with us, Dr. Knepper, and talking about your field of expertise. That's been really great. Viewers, remember that on February 24th, we're going to have our question and answer period, where any comments or questions you put in this video that's going to be posted on Facebook for Dr. Knepper, we'll be answering at that time. Thank you again, Dr. Knepper, for joining us.
Thanks, Teresa, for having me. Thank you, everyone, and happy Heart Month.